This is Dr. Haydar from eMedical Notes. In this video, I will be talking about clinical decision support as one of the new features in eMedical Notes. The idea behind clinical decision support is that in the patient chart, you will get a new table with suggested tests that's based on the health maintenance test that you do have in your system. So the different health maintenance tests, you set them up to suggest those tests based on 4 different criteria. These criteria include problem list, medications list, allergies list, and labs. I will walk you through an example and show you how to set up one of those health maintenance tests. So actually, before we just start doing that, let me show you what this looks like. In the clinical decision support table, you have the suggested test here. The first one is lipids profile, and it's based on the problem list. Second one is blood pressure check, based on the problem list. And then another lipids profile based on medication list, and so on. Let's go ahead and maybe set up one of those criteria in the health maintenance test. To do that, you go to miscellaneous and then click on health maintenance tests. You will get a list of the different tests that you do have in your system. Let's set up a common one, which is hemoglobin A1C. I'm going to click on edit. And this is what you've seen in the past here, the different tests and frequency, start age, end age, etc. But you will see here in the bottom different criteria: problem list, medications, allergies, labs. What we want to do is we want to try to associate that health maintenance test with a different problem list ICD-9 codes. So obviously that hemoglobin A1C, I wanted to show for every patient who's diabetic. So I'm going to go to the problem list and look for diabetes. And you can click more. You can you can pick more than one entry here. The first one is diabetes, circulatory disease, and then I go down in the list. The last one, if I click on shift and then click the last one, it'll give me several entries here. Before I click update, I'm going to also associate it with a lab. In the lab, if lab comes back abnormal, which is hemoglobin A1C, obviously, I wanted to flag that in the patient chart and suggest that test for me. So I'm going to go here and pick up the hemoglobin A1C. Now remember, this list of labs will be different in your office because these are based on the HL7 interface that you have. So different labs will have those names differently. For me here, it looks like hemoglobin A1C. There might be another test that was similar, but for now, I'm just going to pick this one for now. I'm going to go ahead and click update. And let's go to see, let's pick this patient. Gina Doe. Let me edit that. If you go to her patient chart, you will see nothing about hemoglobin A1C because patient does not have anything in the active problem list. Let's assume this patient is diabetic. So I'm going to click on edit, and then in the problem list, I'm going to pick diabetes as one of the problem lists. Now if I go back to the patient chart, you'll see here that in the clinical decision support, you do have an entry for the hemoglobin A1C. And it is based on the problem list. And obviously, this is because we tied that hemoglobin A1C to the diabetes. So now every patient who does have diabetes, you will have that test suggested if it was not done. So if the patient is up to date on this, obviously this is not going to show up. But if the patient, like this one, obviously every 3 months, if it was done more than 3 months ago, it will show up for you to suggest it that that need to be done. So this is about the regular association of the health maintenance tests with different criteria. Again, the criteria are problem list, medication list, allergy list, and labs. There's a new entry or a new feature in the health maintenance test. You will notice here that that is called basic screening. Let me show you how that works. If you click on health maintenance, let's pick colonoscopy, for example. You will see a new entry or a new checkbox here for basic screening. Basic screening would work like this. You will actually pick any of your health maintenance tests that you normally would want to do on a healthy patient. So this is regardless of the problem list and regardless of allergy list, labs, etc. So a good example would be a colonoscopy, obviously, because you normally would do that, for people age 50 and above. Mammogram would be another one. Again, maybe either age 40 or age 50, depending on how you practice. So those tests will be suggested in the health maintenance or in the clinical decision support table based on healthy patients and based on the criteria that you enter here, which is the frequency, start age, and the age and the sex. So basic screening is checked here. Let's go ahead and check a patient that does have maybe John Doe. Let me go to his chart. Patient age is 61. And you'll see here, there's no entry for a colonoscopy. The reason is patient did have a colonoscopy in 6309, and we have an entry. The colonoscopy is configured to do every 60 months. Let's assume the patient did not have that colonoscopy. I'm going to go edit here and delete the entry for the colonoscopy. And go back to the patient chart. You will see here there's an entry for colonoscopy, and the reason is or based on basic screening. So this is a good way for you to, or for the provider to see that this test is suggested for this patient based on the basic screening. And again, you can pick any of the health maintenance tests that you normally have. Obviously, you don't want to pick all of them, for basic screening, only the stuff that you normally do on a healthy patient. I hope this makes this concept of clinical decision support clearer, and this will conclude this video. Thank you for viewing this.